Welcome to the COPD Foundation podcast. We bring you insights from leading health professionals, inspiring stories from those living with lung conditions, practical advice, and the latest in lung health research. Be sure to subscribe, follow us on social media, and visit copdfoundation.org. Take action today, breathe better tomorrow. Just a quick note before we jump into our topic. This podcast series was created for educational purposes only and is not a substitute for formal medical advice. Talk to your healthcare provider if you have any questions.
My name is Stephanie Williams. I'm a respiratory therapist here at the COPD Foundation, and I am here today with my colleague, Amanda. Amanda, introduce yourself. Say hi.
Hi, everybody.
So we are here today. We're going to have a little conversation about exacerbations. And I know for some of you, you may think, why in the world are we talking about exacerbations again? It's really important. That's why we kind of go back to it so often. Mm-hmm. But we're going to talk a little bit about what they are, what they look like, and what we can do to prevent them from happening so often. But before we can really talk about exacerbations and how they affect you, we really need to define what an exacerbation is. So Amanda, can you kind of talk us through a little bit about what an exacerbation is so people can understand?
Sure, I'd be happy to. The definition of an exacerbation is simply just a worsening of your disease or an increase in your symptoms. So when you're having an exacerbation, you may be using words such as like more coughing, chest tightness, congestion. You might be more tired. In words that we will hear and your healthcare provider will hear, and that'll give us a clue to know that maybe you're having an exacerbation.
Right. And so we know that you probably have some preconceived ideas about what an exacerbation is or how it feels or what it looks like. So we're going to talk a little bit, give you a few case studies, give you some examples of some people that you might relate to or you might not relate to yet, but we're going to talk a little bit about how exacerbations look differently. So meet Roger. Oh, goodness. Roger looks like he's having kind of a bad day. Amanda, what do you think about him?
Yeah, I think Roger's having a bad day, but he's on the mend, so that's good. So when we talk about Roger, Roger had been just a little background information. Roger's on oxygen as needed, and he's been managing his COPD pretty well for the last 2 years with the same medications. Everything's been pretty steady. But over probably the last 4 or 5 days, Roger's been having a little bit more shortness of breath and increased coughing. And he started noticing that when he was walking from the bedroom to the bathroom, he was having more shortness of breath. He'd have more coughing. And he even started sleeping in the recliner in the living room just so that he could rest better and he could get a little bit, more air. And so he'd been using his nebulizer multiple times a day for the last 3 days. And he was beginning to, in between the use of those, feel like he needed to use it even when it wasn't time yet to do another treatment. And he also was feeling like he needed to turn his oxygen up a little bit. So as you can imagine, Roger's wife was a little bit nervous. They've been married a long time, and he's, sleeping in the recliner and he's coughing. And so she talked him into going to the ER last night, and they did admit him to the hospital with a pretty severe COPD exacerbation.
Right. And I think Roger probably is the picture that most of us think of when we think of a COPD exacerbation. We think someone that is so sick, they need to go to the emergency room. They're going to stay in the hospital a couple of days, and then they'll go home and do their recovery at home. I think Roger is probably what we think of the most when we think of COPD exacerbations. But I want you to meet someone else. I want you to meet Margie. And, Margie she was doing pretty well. She was on her regular medications and she was doing pretty well with those for the last 5 months or so. But a few days back, she started noticing that she was requiring her rescue inhaler more often than ever. She had been doing so well on her regular respiratory meds, she hadn't really needed a rescue inhaler. So this caught her attention when she started needing that rescue inhaler a few days back. Then yesterday when she got up, she, throughout the day noticed that her cough was producing a different color mucus than what she's used to. She's used to having just kind of a clear substance when she would cough up, but now she's noticing it's thick and it's yellow. And then also now today she has a low-grade fever. So does this sound like Margie's having an exacerbation? What do you think?
I definitely would say that Margie's having an exacerbation, Stephanie, especially if we go back and we look at the definition, which is simply an increase in symptoms. And so we see that the medication that's been working for Margie at the level, at the times a day that it had been working for her, is no longer doing the job. And we also see the changes in her mucus, and then of course the addition of that low grade fever. So that's definitely a clue that something's going on that she needs to take care of.
Right. And it doesn't necessarily mean that she's going to end up in the emergency room like Roger, right? But she does need to be aware that these symptoms do mean she's having an exacerbation. She needs to call her healthcare provider. Her doctor needs to know that she's having these changes in her symptoms. So let's go on a little bit here and meet our friend Keith. Now, Keith is still out working. He's in the workforce. He goes to work Monday through Friday. He's still able to do that. But the past few days, he's felt a little bit of chest tightness. He doesn't usually ever require his rescue inhaler at all. But yesterday he had to have it twice, and today he has had to have it twice. Is Keith experiencing an exacerbation?
Yeah, Keith is experiencing an exacerbation also, because we see he's had a change in symptoms, more tired, more chest tightness, and an increase in the need for the use of his medicines. But like you said before, a lot of people overlook this and they don't think about it being an exacerbation.
Right. So if we look at all three of our friends here on the screen, and we see Roger in the hospital bed, and there's Margie at home with that inhaler. Keith is out working in his yard, but he's using his inhaler. All three of these are experiencing exacerbation. They're just at different stages of exacerbation. So while Roger had to go to the emergency room, maybe Margie won't have to if she can get in touch with her doctor and can maybe get an antibiotic or steroid or something to take it home. And maybe Keith won't require any of that. Maybe he'll be okay in a couple of days just doing what he's doing with his rescue inhaler here. But it's really important to keep an eye on what your symptoms are, to what your normal is. And we'll talk a little bit about that in a few minutes when we get to the My COPD action plan. But why are we always so concerned about exacerbations? Why do we talk about it so much, Amanda?
Well, we talk about it a lot because people like Roger, who have a severe exacerbation and they've been in the hospital, or even people like Margie, who might be able to take care of their symptoms by making a phone call to the doctor. Any sort of exacerbation, a moderate or severe, can put you at 46% more likely to have a severe exacerbation in the next 6 months.
Yeah, and we don't want that
number. Yeah,
that is huge.
Mm-hmm.
Yeah, I mean, your risk goes way up of being back in the hospital once you have a moderate or severe. So again, Roger and Margie, are more likely to have another exacerbation in the next 6 months, and that's pretty significant. And then also, if you've got a cardiovascular disease, if you're having anything like heart failure or arrhythmias or stroke or heart attack, and you also have a COPD exacerbation, you're at risk of having a CVD event within 30 days of having that COPD exacerbation. So it really is in your best interest to notice these signs and symptoms early and to intervene, get help early before it gets worse.
And Stephanie, I think it's also really important that people understand how one type of disease can impact or one body system can really impact another. And so some people might not think, they may think, oh, it's just my breathing, but our body really works together. All of our systems work together. And so as you can see with this statistic here, that within, they're at high risk of having a cardiovascular event, it just shows how we have to make sure that we're taking care of ourselves as a whole, because one disease state can really, really impact another. And so we have to try to keep our body healthy all the way around.
That is so true. And then lung function may not be back to normal for up to 8 weeks after an exacerbation. I think when people are, they're experiencing the exacerbation, whether they are in the hospital or not, they expect to bounce back really quickly. And, if you have a severe or even a moderate exacerbation, it may take you up to 2 months to really begin to feel like your lung function is back to normal, if it goes back to normal. So I think it's just important for us to know all of these things. This is why we talk about it so much and so often. So what can we do to keep exacerbations from happening? What can we do? We have to recognize the symptoms early, and then we have to take action. We just have to. And one of the tools that we have at the COPD Foundation is this, the My COPD Action Plan.
The COPD Foundation's My COPD Action Plan is a tool for tracking COPD symptoms and navigating treatment when you aren't feeling your best. It has a table for tracking breathing during normal activity, as well as a stoplight feature to help you visualize and know which actions to take based on your symptoms. Make sure you discuss your action plan with your healthcare provider so that it is tailored to your individual needs.
You can actually access it on a paper version here, and I'll give you the link for this in just a few minutes, or you can access a version of it on our PCG app, our Pocket Consultant Guide app. So if you're more inclined to keep up with things digitally on your phone, there's a place for you to do that right within the app, and it will actually keep track of your green days and your yellow days for you. But this tool here, this paper version, I like the act of filling things out, but if you will go through this document, fill it out with your physician, with your healthcare team, this is a really nice way for you to be able to communicate what you're able to do, how well you're able to do something with your provider. And then they are able to understand a little bit about what it's like in the daily life of you. And so you're able to communicate a little bit. So when things change, and maybe you fill it out today and you can change the bed, you can climb stairs, you can shower and bathe without any difficulty. But maybe in a few months, something happens and you can call your doctor and say, I was looking at that COPD action plan. I'm not able to do those things as well anymore. It takes me a little bit more time, or I need a little more assistance. This is a nice way for you to be able to communicate and really have that interaction with your physician so that your doctor knows that you know what normal is like for you. Anything else you want to add, Amanda?
Yeah, I was just thinking back about Roger. And, if Roger, this would have been a wonderful tool for him to have had in his tool belt prior to starting to, have an exacerbation, because when he started feeling a little bit more short of air moving from the bathroom to the bedroom, then, he would have known what his baseline was and could have referred to this action plan and say, wait a minute, last week I could do this and it was okay, but this week I'm having a little bit more trouble. And then he would have been able to see where he was and potentially avoid having to have that hospitalization.
Exactly. Wouldn't that have been nice? I bet, and not every exacerbation can be avoided. We want to say that. Not every exacerbation can be avoided, but we sure can try to get out in front of as many of them as we can to keep them from progressing into needing a higher level of care. Yeah. But it is really important for you to have this conversation with your doctor so that you know what a normal day looks like for you and what you need to do on those normal days, what a yellow day looks like for you, and what your doctor wants you to do on yellow days. How many yellow days does he want you to have before you call his office, for example? And then, of course, the red days, those are call 911 immediately kind of days. So we're not going to sit back and wait for anything to happen. We're going to take that action right away. But it's really important for us to know what signs and symptoms of exacerbations are, and they differ for everyone. So you need to really take stock of what that means for you.
Yeah, I think you really said something important, Stephanie, is being aware of how your body is, because everybody's body's different. And just being very, very aware of what your baseline is and what your normal is, so that when you start to feel anything that's out of that, then you can refer to the tools that you've been given by your healthcare provider.
Yeah, I couldn't agree more.
So you might be wondering where you can locate the COPD action plan. As Stephanie mentioned before, you can locate it digitally in our PCG app, and that app can be found in both the Apple Store and the Google Play Store. And you can also locate it online at copdfoundation.org. Go to the Learn More tab, and then you'll see on the right of that tab, Educational Materials and Resources, and the COPD Action Plan is housed in our Downloads library.
Under the Learn More, and I'm new to COPD, we actually have a section that says what is an exacerbation. So you can go there and there's a ton of resources in addition to that action plan where you can just get some more information of what does that look like.
Great. That is great guidance. We have lots of education materials here, so you will never be bored. There's always something that you can pick up and read. And then if you have other questions, if you want to reach out to anyone and ask questions, or you just feel like you need a little bit more information, please join us at COPD 360 Social. It's an online support group. It's an online community for people just like you. And we hope you will join us there and join the conversation that's happening every day.
Thank you for tuning into the COPD Foundation podcast. And remember, whether you're managing a chronic lung condition, providing support to those who are, or just want to learn more about lung health, the COPD Foundation is here to support you. Be sure to subscribe to this podcast and follow us on social media. Take action today, breathe better tomorrow.